All right, so the purpose of this video today is we're going to demonstrate both Phalen's and reverse Phalen special tests for carpal tunnel syndrome in the wrist. In order to perform this test, I'm going to have the patient sitting. I'm just going to ask that the patient kind of mirrors the image or mirrors what I'm doing. So for Phalen's, I'm going to ask that you put the back of your hands together and then bring your wrist into max flexion. I'm looking for recreation of his symptoms within 60 seconds. Phalen's produces a compressive force on the median nerve in the carpal tunnel. Another common test that's performed that's clustered with Phalen's is reverse Phalen's, which is very similar. I'm just going to ask that the patient puts his palms together, and I want it to ensure max extension. This places a traction on the median nerve in the carpal tunnel, and I'm looking for recreation of symptoms within 60 seconds. A positive test is recreation of his symptoms, numbness and tingling into the hand.
Today we're going to go over two special tests to assess for carpal tunnel syndrome. First one is Tinel's test. You can have the patient seated and locate their carpal tunnel and tap it 5 or 6 times in order to compress the median nerve. A positive test would be recreation of their symptoms into the hand or numbness and tingling, which can indicate carpal tunnel syndrome. The next test is the carpal compression test. Again, the patient can be seated. I'm going to grab their hand, locate the carpal tunnel, apply moderate pressure with my thumb until recreation of their symptoms, or 30 seconds, compressing the median nerve within the tunnel. Positive test is recreation of symptoms into the hand or numbness and tingling, which could also indicate carpal tunnel syndrome.
So this test is called Froment sign. It is the gold standard for testing ulnar nerve neuropathy. It can be done seated or standing. And to start, you would ask the patient to grasp a piece of paper in a key-like pad-to-pad grip with the thumb and attempt to remove it from their hands. A positive test would be if the patient cannot maintain this grip and flexes the DIP joint of the thumb or loses grip. This positive would indicate an ulnar nerve neuropathy.